Yeah. Hey. All right. Hey. Yeah, I mean.
So we about to take off.
Hey. Please do remain calm. About to run against it and with a little bit of soul, no times.
Welcome to Please Remain Calm. I'm Ben Gonzalez.
And I am Daniel Gonzalez. As always, folks, the opinions expressed here on the Please Remain Calm podcast are our own. They do not reflect the opinions of the Los Angeles City Fire Department or the Los Angeles County Department of Health Services. Also, guys, it has been a few weeks since we've been on here with you.
It has. We've been pledging to do regular episodes again. Yeah. We're really trying.
It's hard, man.
Yeah.
It's hard with full lives and two kids that are,
There's just been so much going on.
It really
the
has,
last
dude.
few months has been like so crazy because we have another project that we're working on too. And even that we've like had to put on hold because of just too much shit to do.
Yeah, and things going on with life, and
yeah.
two boys that are preteens, and you as well, and baseball sucks up our whole life. So it's been a couple weeks. Please, guys, don't forget about us. If you are listening to the podcast, if you like the podcast, like the episode, comment on the episode, share it with your friends. All that stuff still helps us grow. We are still here. We are still going to be producing episodes and podcasts and booking great guests like the one we have today. And that's another thing too. We're trying to put out episodes where we actually have guests. And not just continue to put out episodes where it's just us talking about a topic or anything, even though when we do have a topic that's worth talking about, we will do that again. But
that was the thing too, is people would always ask us too, like, how do you get guests? How do you always have guests that like had something happen to them? And like, now we've done over 100 shows.
It is hard, man.
We've kind of gone through the roster of guests.
and just like we said before, it's not just difficult finding a guest that's willing to talk about the most traumatic thing that's probably happened to them in their lives, but it's also scheduling. You know what I mean? You've got a schedule. I've got a schedule. A guest has a schedule.
Then the studio has to be available too.
Yeah, all that stuff.
It's a whole thing.
So yeah, all you sending me messages, where's episode 104? Or what, when's the next one coming out? All that stuff. I hear you. We are constantly trying to book and get in here in the studio. And luckily today we're shooting 2 episodes. So we'll have a couple more coming in for you.
Yeah, because we also have like things happen and then we don't do an episode about it, and we kind of like forget about the thing, and it's like out of the news cycle.
Yeah.
There was like a mass shooting in our county that was an MCI, and like my work's involved in the whole thing.
Yeah,
and we just let it go under the radar because we weren't doing any shows.
Yeah.
Like I saw another comic that did a joke about it. That was actually really funny.
Wait, what shooting are you talking about?
See, exactly. See?
Well, they happen so
Monterey
damn often.
Park.
Oh yeah, Monterey Park. That's right.
And he did a joke about it, and then that reminded me, like, oh yeah, this happened, and we just
I've actually worked. One of our previous guests, PD Montero, was actually an auxiliary from Monterey Park.
That's right.
So after that happened, I contacted him. We're actually working on trying to get some of a couple of the firefighters or paramedics that were actually there. That happened right around the corner from one of their fire stations.
Yeah,
too.
and it was funny too because the captain that was their IC there had called us to get some numbers on stuff, right?
Yeah.
No, a couple days later.
Oh, gotcha.
To get stuff for the report and everything.
Yeah,
and I almost asked him, and I was like, I'm on a work line. Yeah. Like I've been pretty good about keeping things separate and everything. I'm not gonna like hit up a podcast guest.
You're better than me, dude.
I know, dude.
I'd be asking everybody.
I know, and that's the thing too. Like maybe if he had come into the office, maybe I would have asked him in person, but just like on the phone, I'm not gonna like go into the spiel about, oh, by the way, I have a show. Do you want to? Yeah. I have done it in person though. I've been trying to get the medical director for DHS.
Oh, okay.
Come on here. Yeah. He's cool.
And then we had, not to put a down note on the episode, but our grandmother passed away a couple of weeks ago, and it was expected, and so we had to go to Arizona for the services and stuff because that's where our grandfather is buried, and then met up with one of our cousins who is the actual former fire chief of Phoenix Fire Department, talking to him about coming on. So everywhere we go,
I know I pitched him
no
for the
matter
other
the
thing
situation, we are always constantly thinking about the podcast and trying to get guests and stuff like that. So bear with us, man. We're doing the best we can here.
Like
we're
literally,
just two
like all the big things that you could be having to go through in the last few months, like that's what we've been doing. Other than like changing jobs.
Yeah.
Pretty much everything else, like you're fixing your house, like there's so much stuff.
Yeah, man, just been working a lot. Some interesting, crazy calls. It's been super busy at work for some reason, man. We are just like running our asses off. And like legit calls too, which is kind of unusual. I mean, those of you that are in this business know that it's not always, the craziest call. It's not always, that's why like a lot of these like fire department based shows and stuff like that. It always seems like they have to like inject drama into those things, because the job where you do have high drama sometimes, it's not constant. It's not like every single call is like the craziest call you're going to go on. But then you'll get in these runs of where you have like these.
Yeah, like, what the hell's going on?
Yeah, like you'll have a day where you have like 3 crazy traumas, or it'll be like a shooting day, or you might have like a chest pain day where like you have 6 chest pains. You're like, what the hell? You know,
all day. Yeah, you never know.
But yeah, we've been having crazy calls. My partner had a shooting, crazy shooting. A guy tried to rob an old lady of her Rolex on the sidewalk, middle of the day, and a construction worker across the street with a concealed carry ran across the street and capped that dude.
No.
Capped him. One in the eye, one in the chest.
Yeah.
And
he was robbing the lady at gunpoint?
Yeah. Had a gun on the lady, and the construction worker ran across and shot him. So that's crazy. That's something you don't see every day. Shootings in general.
And this is in Venice, right?
Decreased. No, this was actually a little bit more like K-Town-ish. He was working sod. My partner Matt.
Yeah.
And then we had a funky call. I always try to like remember and kind of like earmark these little or dog ear. I don't know what you want to say, but remember these little like funky calls to kind of talk about them on here, just to put it out there, because I'm a big, when I am teaching or I'm talking to like young firefighters or rookies, or if I have an intern or something like that, one of the biggest things that I try to push on them is don't judge a book by its cover. You don't know for certain, number one, what's going on with somebody, what position they're in, what medical condition could be causing them to act this way, if they're being difficult, if they're being uncooperative, shit like that, right? Yeah. So briefly, before we get to our guest, we got a great guest today, but this kind of is something that happened and kind of fits with his story a little bit. But I was working a sod day down at the airport. And we got a call early morning for a altered patient. We get there, and there's this guy. He's sitting there. He's got shorts on and a t-shirt, and he had come for a business trip to LA, and wasn't feeling well the second day. Said he was going to go to his hotel, and then nobody heard from him anymore. And they were trying to call him, contact him. Nobody could get a hold of him. And they pinged his phone, find his phone, and he was at the airport. So one of his coworkers went and started looking around the airport and found him just like sitting, leaned up against a pillar in the baggage claim area. T-shirt, shorts, just like 4:00 in the morning. Scrapes and scratches all over his legs, his arms, stuff like that, right? Yeah. It's kind of pale, kind of sweaty. So
detective time. Yeah.
So me coming up, oh, this guy's high. That's what I'm thinking initially. He looks like somebody who's been doing meth for a few days and is on the down, coming down off it and stuff like that. You go to talk to him and he perks up and he'll answer some questions, but doesn't answer others, gives kind of funky answers to others. He's just off, right? So do all the stroke assessments, the MLAPs and everything is negative. He's got equal grips. He doesn't have any facial droop. He's not slurring his speech. He just doesn't answer questions correctly, or he'll sit there and just stare at you, and he's really slow to respond. Scrapes all over, like in lines, right? Which is weird. I'm like, how do you get those? And then I'm thinking, well, maybe he tumbled down the escalator, right? When the escalator scratched him. But he had like marks all over his arm that he was picking at. That's indicative of somebody that's doing drugs, right? So we're sitting there and we're like, God, what the hell is up with this guy? Sugar's normal. EKG was normal. Blood pressure is a little bit high, but just couldn't put a finger on it, right? So I send all the, we can electronically send to our base hospital. I send the EKG and everything, and I go, hey, his EKG's got a couple little funky things. We're wondering, do you want us to come to you? Want us to go? So UCLA base goes, go ahead and take him to the closest, which was Marina Del Rey over there. So we take him in there, drop him off. They put him in bed 1, which is like their kind of like critical bed, Right. And we take off, And every once in a while, when you have a funky case like that, follow up. When you come back in, hey, what happened with the dude in bed 1, right? So the next day, I was working back at 63s, and came in with another patient, and the doctor came up to me, right, which is pretty unusual. The doctors don't give a half shit about talking to you or explaining shit to you. So he comes up to me, and goes, hey, Gonzo, he goes, that guy you brought in 1. I go, yeah. Oh, what was up with them? Myocarditis.
Oh, yeah.
So he had
how old was he though?
So he was like my age, man. He's like 40, 43, 44, something like that. So he had a history of a valve replacement, I guess. And somehow, some way, that thing got infected, and he got myocarditis, and it created clots. And those clots, they think he was shooting or throwing small clots that were going up, and he was having basically like small CVAs.
Wow.
Yeah. And so in my 10 years ago or 15 years ago, when I was coming out of 9s, going to 57s, I would have probably treated that guy like a piece of shit. Like I probably would have treated him like a drug addict because that's what everything was pointing to. Even though you talk to him, hey man, you use any drugs? No, never. Right. And I even talked to his wife, because a coworker had his wife on the phone. Hey, does he have any history of da-da-da? And she goes, no, never. I've never seen him but I went back when I was using drugs and drinking a lot. I kept that shit hidden from everybody too. So you take all that with a grain of salt also, right?
Yeah. The other thing too, though, is if a guy is your age or younger and has a history of myocarditis, he's already had a valve replacement. You can have those for various reasons. Yeah. But a big reason for guys who are younger is drug abuse.
Yeah. So everything points to that. Even now, in my 20 years, with the history that I have and my attitude toward patients and stuff like that, I was still, this guy's on drugs, dude. Or this guy came out to LA, he's got no wife, no family to answer to, and he relapsed or something like that. That's what's going on. So, and 10 years ago, I would have treated him different. This time around, though, being the age and the medic that I am now, I caught myself thinking that and go, okay, well, let's take a step back and, let's not judge this dude. And we treated him properly, started the IV, did all the things we were supposed to do, and took him. And it turns out he's got this serious. So they were transferring him to, from Marina to Cedars affiliate, transferring him to Big Cedars for surgery, basically fucking open heart surgery to work on that valve again. So I thought that was interesting. I thought I'd bring it up for all you young guys, gals that are out there on this job. It is real easy to assume something about somebody. You got to really fight that urge and treat what you see. Do your best to treat people with dignity and respect. And that is an easy, quick, and best way to, number one, treat people properly. Number two, not get yourself in trouble. Okay? Right. I was just explaining this to our rookie the other day, man. It is so much easier on this job to simply follow the rules. You know what I mean?
100%.
That's
why they're there.
Every rule's in place because somebody fucks something up at some point, and they go, "Oh, we need to make a rule about this so it doesn't happen again." So just follow the rules while you're out there. Don't be maverick. All right? Don't be maverick.
Even if you're not sure of the rule, if you think this is questionable, it probably is.
Yeah.
You know what I mean? Just don't do it. Another thing too is don't really try to diagnose people. In the field. You know what I mean? Treat the symptoms, treat the patient. But if you would just clock this off as drugs and shit. Yep. Yeah. Who knows how it could have turned.
But we had that. We've had some crazy auto accidents, crazy auto peds. We had 3 or 4 auto peds. We had a guy that got hit by a car that wound up wedged in the windshield. The passersby had to pull him out of the windshield and doing CPR on him when it came out. We've had some crazy, right across the street from the station.
Yeah.
Car accident into a hydrant, and it was filling the car. We had to cut the guy out of the car because it was he's slumped over in the car. The thing's filling up with water. It was crazy, dude. I'm telling you.
This is like an episode of 911.
The past few weeks have been nuts. I'm telling you. Okay, let's get into our guest, dude.
Yeah, because we're staying on that theme of medical mysteries. Sometimes the paramedics don't know what's actually happening. Sometimes the doctors don't know what's actually happening.
Sometimes it takes weeks or months for them to figure out exactly what the hell's going on.
And that's what happened in the case of our guest. Our guest today is a paramedic from Fresno, California, just north of here. I shouldn't say just north of here. It's
pretty damn
4
north.
hours north. The real California. Mario Torralva.
Hey guys, thanks for having me.
Thanks for doing it, dude.
Thanks for coming, dude.
So Mario, I've known for a year or so, maybe something last year.
Yeah.
Did comedy at his sister's restaurant. We were talking. He's a medic, good dude. Started listening to the podcast as well, started sharing stories and stuff, stayed in touch. And he told me a story over dinner that blew my mind. That's something that happened to him. As a medic, when you're a paramedic, you never, ever want to be a patient under any circumstances for anything.
I know all the secrets.
I don't want to go to the hospital.
I don't want to be on that gurney.
Be admitted to a hospital. I don't want to be in an emergency room. And I definitely do not ever want to call 911. I never want to have paramedics show up and treat me. Is that a consensus?
I mean, yeah.
You feel about the same way, right?
I'm more I know what's been on this gurney.
Yeah,
I know who's been back here puking on this or puking on that, and you can't get all the nooks and crannies. You know what I mean?
Yeah, just no. So Mario told me a story that entailed all of that, and it was a legit mystery because my wheels were turning in my head trying to figure out what happened to you while you did this. But let's go back a little bit.
Start at the beginning
into what happened here. How long you been a medic, dude?
Oh man, so I started at American Ambulance in 2009 as an EMT, straight out of the military.
What branch of the military?
I was in the Army.
Oh, okay.
I did 4 years, and I was at Fort Hood. And I was getting close to my contract expiring, and I was like, do I want to re-up? Do I, want to do something else with my life? And then they like slammed orders with Hawaii. And they're like, hey, we'll send you to Hawaii if you re-up. And we were like, all right, let's do Hawaii. This sounds good. And one day me and the wife were talking. She goes, hey, I don't think this is a good idea. And I was like, all right, that's all you got to say.
Yeah.
We'll go to Hawaii on our terms. Well, fast forward a little bit, I'm thinking, well, what am I going to do? And I was like, well, maybe I'll go into the fire service, Yeah. I'll move back home and I'll join the fire department. And someone said, hey, take the CMT course. You're still in the military. We'll pay for it and all this other stuff. So I had to convince my chain of command to send me through. So finally they sent me through. It was a 4-week course.
So you weren't a corpsman or anything in the military?
No, I was actually a mental health specialist. But when I was overseas in Iraq.
At Fort Hood?
At Fort Hood.
Oh, wow.
Big installation. And there's a lot of people coming in and out. But when I was overseas in Iraq, we did our mental health services, obviously, but we were at a small forward operating base. So I got to do some really cool medical stuff too that I would never be allowed to do here in the States.
Now, does the Army have their own corpsman, or is a corpsman Navy?
We just call them a medic. So
okay.
I was a 68 X-ray, which is the mental health specialist, and the actual medic is a 68 whiskey.
Okay.
So everything 68 series is medical.
Okay.
Right. Yeah, but forward operating base, that's what you're the only people out there pretty much, right?
Yeah. I'd say the base I was at, a square mile maybe. It was an old air base, and obviously we weren't using it for air operations. I mean, we would bring helicopters in, but that was about it. I spent most of my time, it was Fob Summerall is actually what it was, and I think it was just outside of Beiji, Iraq. And so for 15 months I was over there kind of doing the soldier thing.
That's an experience.
We had a guy who was a corpsman with the Marines who was at a forward operating base in Afghanistan. He said it was like the most remote base, and that they were basically like the doctors for the whole area.
Yeah.
Like everybody brought everything to them.
One of the crazy, and I want to say this, like my experience in Iraq was nowhere near as bad as a lot of others. I wasn't infantry.
Yeah.
I wasn't even a full-blown medic. There was a time or two I did go outside the wire. Wasn't allowed to. Don't tell my commander. But and I never really did a whole lot as far as combat is concerned. But I do remember an incident where there was an explosion just outside our gates. It was a huge, what we would call MCI essentially. A lot of Iraqi civilians were injured, and I remember one of the things I will always remember is I was in there with the doc, and he was like, "Hey," he's all, "everybody's doing everything," and I said, "Okay," and he goes, "Let me see your hand." And he goes, I was, all right. He gave me, and I pretty much went into his chest, and he goes, "You feel that?" I was like, "Yeah, that's his liver." And then he goes, "All right, now come over here." I says, "I need you to apply pressure to the aorta." And I was like, "Well, where's that?" And he put my hand over it and just apply pressure until we could figure out, how to stop this bleeding.
Yeah.
And that was
it's gnarly.
Yeah.
I'll never do that here.
Yeah, it's gnarly, man. That's like when I was going through EMT and doing my my internship at the hospital, you do it at a trauma center. And that was my first experience with like a chest cracking. You do it at a trauma center when you have somebody that has like a shooting or stabbing or something like that, they need to operate, get in there quick, they'll crack your chest. And so I'm doing CPR. And then the doctor goes, "Hey, move." He squirts betadine all over, right? And I'm just fucking doing it. And he goes, "Hey, move your hands," and move my hand. And he slices that thing open. He puts the crank in, cranks. I'm like, holy I mean, right there. Pulls the guy's lung out, which is blowing up every time they're bagging him. You know what I mean? And then he goes in there with the paddles and started shocking the heart. And then he did an internal cardiac massage. Just pretty much like I didn't do it though. He didn't grab my hand and put it in there. So
one thing I learned is there's no real scope of practice in the military.
Yeah.
Sure. If you got hands, you're going to do what we need.
Sure, yeah.
You're the guy.
I remember one time I needed stitches. I was a little PFC that did it, and I was a specialist. He was only one pay grade underneath me. I was like, man, and I didn't know nothing about medical stuff then. And now I'm like, there's no way.
You're thinking back of everything that they're letting you do.
So you go through EMT school.
Go through EMT school, and they start out processing me. I start, finaling out of the military, and they start, all right, let's build your resume so you can apply for American Ambulance, because that's where I wanted to work. And kind of really to go back a little bit, like I had a lot of experience with paramedics as a child. American Ambulance. My dad is an epileptic. And it's under control now, but in the early stages, as a little kid, seeing your dad have a seizure, you don't know what that
scary.
is.
For sure.
Yeah.
So there was a couple times that paramedics would come out, and they always treated us really well. And when I was in high school, my dad had gotten into a car accident. And from what we gathered, he was a trauma code.
Whoa.
And he was extricated, and it sounds like he coded after the extrication.
Whoa.
And if you saw my dad today, you would
That's
have
crazy. Yeah.
no idea. I don't know. Have you met my
I
dad?
met your dad. Yeah. He's cool.
Yeah. You would have no
I
idea.
didn't know he was epileptic even.
So
he owns restaurants and stuff, man. He's like super cool.
Oh, yeah.
So you would have no idea. And I think like it was the paramedics, of course, you have the surgeons and all that stuff, but if it wasn't for EMS where it is today, you would have been dead on the side of the road.
Yeah.
So that kind of, fell away, was inspired by the show Emergency, joined the military, decided, okay, this is what I'm going to do. And started working for American Ambulance. And maybe about a year in, I was like, I don't know if I want to join the fire department. I'm kind of happy here. It's a private EMS company, and it was nothing against the fire department. I just kind of got out of a very militaristic culture. And I really wasn't about to go back into that.
Yeah.
So
it's hard too when you come out of the real military and then you go to like a paramilitary organization, and it's some like, it was the same. It's the same thing that like happened with I had a buddy. I have a buddy, John Holt, who is a great guy, man. He's a captain now, but he was a corpsman. He was a
recon.
He was a Marine recon.
Yeah.
Okay. So when you're a rookie and you come out to a station, there's this historically. The rookie gets treated like shit.
The probation,
right? Yeah, probationary member gets treated like shit. That's kind of changing now over the years. There've been some rookies that sued because they got treated too much like shit. But it was one of those things. Your rookie year sucks. People treat you like shit, and you learn in this like high stress environment. So, he got to nines, and the guys were kind of treating him like that. And I've never like bought into that really. I've always I just treat people the way that they present to me. And then, so I was always really cool with him. We became friends. And then I found out he was, Marine recon. He had spent all his time behind enemy lines and all that stuff.
Military.
Killed all these dudes.
Had a bunch of kills and stuff. And it's like the dude yelling at him for not cleaning the toilet. You know what I mean? It's like, dude, you haven't done shit. And this dude is real. And so I can see how being in the military, like not wanting to go into a paramilitary organization like that, I could see how that would be a problem.
Yeah. And I'm glad I made that choice. And about a year in, I was like, I'm going to go to paramedic school. And the great thing about American Ambulance is we'll pay for you to go to paramedic school.
Oh, yeah.
That's awesome.
And
that's key right there.
Yeah.
Yeah.
So, and I managed to work full time. I don't know how I did it looking back, but I worked full
You worked
time.
full time in school?
48 hours a week.
Dude.
On the ambulance, and then school on the days I wasn't working.
Yeah.
So that was clinicals, internship, everything.
That's crazy.
So that final internship shift,
tough
driving from that 24, going to another 24 to actually get paid to work, that was the best feeling in the world.
Yeah.
So became a paramedic. I became a preceptor in 2012. Oh, paramedic in 2012, preceptor in 2014. About 2 years ago, I got promoted to operations supervisor.
Nice.
So I still do the paramedic thing. And then on my shift is Friday nights, I'm supporting the system, working the schedule, helping crews get cleared, working with the hospitals. And the next goal is hopefully I can get into management.
Yeah.
So I love where I'm at. It's a great place.
Yeah, that's what I've always heard about American, because they are like the biggest company in Fresno County. They have all the 911 contracts. They do everything out there, right?
For the most part, yeah. Some of our rural services, they still do fire-based EMS. Mm-hmm. But, the great thing about so we cover 4 counties, Madera, Tulare, Kings, and Fresno. The cool thing about it is we're primarily out of Fresno County and Kings County, but we all have each other's backs. So if something goes down in Fresno and we need more ambulances, they're going to send us ambulances.
Boom, yeah.
If something goes down in the other counties, and they need us, we're going to go help them out.
Yeah.
And that's
Yeah, mutual aid.
Yeah, mutual aid agreement.
Yeah,
and it works out great.
And that area out there in Central California, it's where like, what is it, like 90% of the produce in America is grown there.
That's what they
or
say.
Something like that. Yeah. There's all the almonds, the pistachios, everything comes from that area. So there's a bunch of farms. Fresno is actually like a pretty big city though.
I feel like it is. It's no LA, but it's I feel like it's a big city, you know.
Yeah. It's like 500,000 people or something, right? Yeah. It's a pretty big town.
The actual city of Fresno, I think it's maybe right around 500,000.
Yeah. So it's a decent sized city, but it's a lot of area to cover. And you've got like different stuff you got to deal with like farm accidents.
Yeah, we have our industrial, we have our rural communities, we have our metro area, we have our wilderness areas up, in the Sierras.
Yeah, that's right.
We cover a lot of ground.
Yeah.
But we do a great job.
Got to be well rounded.
Yeah.
I was gonna say you get to break out like the whole book of
and
treatments.
I'll tell you what, like, I've learned quite a bit. I can't speak for other EMS agencies or other companies, but we're it, and we do a lot and we learn a lot. You learn really quick too.
Yeah, it's like one of the best situations you want to be in as a paramedic, especially a private paramedic. So let's get into what happened to you, sir.
Well, so the shorter version of the story is I went to bed October 13th. October 15th, I woke up in the ER.
Whoa.
And so this first part of the story, I'm going to kind of tell from my wife's perspective. She's in LVN school, so she wasn't able to make it. So
okay.
She's working hard over
there.
The
one I got from you was like at the fair.
Yes.
Or something, right? Okay, yeah.
So from what I understand, everything seemed normal. Got up, went to church, and we're going to go to the fair. And our fair is a really big event. We have it for about 2 weeks. And there's a lot of people there and a lot of things to do, a lot of food. It's a county fair, I guess.
Mm-hmm. Yeah.
Well, we decided we were going to go to the fair that day on October 14th. And we were talking to a friend from church and she says, hey, we'll come too. We're like, all right, cool. So my wife says, we all get in the car. We all carpool over there so we only have to pay for one parking entry, And one of my really good friends was also there, Matt Melvin. He's a paramedic and he's actually in nursing school now. And I guess we met up with them at one point and, he says everything seemed normal. You were talking shit like you normally do. We were, making jokes about the way they were preparing the meat and how they have the different colored tongs. And
just to be clear, you don't remember any of this?
You said
you went to bed on the 13th. You're talking about the 14th?
Yeah. So this is the 14th.
Okay.
So I am looking back. There are certain, it's really weird, flash memories, kind of almost like pictures. I remember seeing a lot of lights, which, at church we use a lot of lights and it's a fair.
Yeah.
So there's going to be a lot of lights. So I remember that and I don't, and I remember certain events now, but coming out of it, I only kind of remembered lights a little bit.
Okay.
So, we're all having a good time and doing our thing. And my wife said probably at about, I don't know, in the early evening, I came up to her and I just said, hey, I don't feel good. And she goes, okay. And she goes, what's wrong? I was like, I don't feel good. And she says, I just wouldn't specify what was going on. All I would say is, I don't feel good. And then she saw me looking at my watch and she says, what are you looking at? And I was like, my heart. She goes, what? And then she thought, oh, is he looking at his heart rate?
Yeah.
So then she looked and she saw 130, 140. So she's like, oh, well, you really haven't drank any water, I don't think. Let's get you some water. So she took me to a little area, sat down. They got some waters, which is not fair or is not free at the fair.
Yeah.
So started drinking. And then we decided, my wife, my friend, or our friend, and I guess I decided to hey, let's just go home. So, we're done. Everyone's kind of tired. And we were walking through kind of the exhibition areas and I guess they lost track of me and they started walking back and they saw me and they said it looked like I had looked like I was somebody that was from hundreds of years ago. And I just got put in a time machine and I got put right here. And I'm just looking around
yeah, what the hell?
Yeah.
What is this?
So then my wife's what are you doing?
Yeah.
And I just kind of looked at her and she said, something's not right. So she sat me down And she said from there, things just started to happen really quick. She said, I started to kind of fall to my right side. I was getting diaphoretic, really sweaty and just kind of pale.
Sure.
Mm-hmm.
And she's, you know, she's thinking, oh, like, you know, I've heard him talk about these before. My husband has a head bleed. You know, this is it, you know?
Yeah.
And American Ambulance we do the standbys there. So we'll have anywhere from 2 to, you know, however many crews we need there responding in golf carts to support. And, you know, you were talking about it earlier. And like one of the rules I told my wife is I don't ever want to be in an ambulance. 2 exceptions. 1, I'm dead. 2, I don't remember.
Yeah.
Okay.
Yeah.
So right away, our friend of ours, Lillian, she went to go get help.
Yeah.
And my wife said a police officer came first, and he's on the radio, and he's saying something about diabetes or a diabetic emergency or something like that, low blood sugar. And my wife said maybe a few minutes after that, the golf cart showed up. And I know this now. The paramedic happened to be a paramedic I went to paramedic school with, Sandra Castro, and her partner was Javante Hicks. And they just, you know, from what I understand, I just wasn't really, I was talking, but I wasn't making sense.
Yeah.
You know, and they tried to kind of stand me up and pivot to put me on the golf cart, and I just kind of collapsed. Well, Jay Hicks, he's a big grizzly bear of a man. And this guy, I kind of remember, he just kind of grabbed me and just like put me on the golf cart.
Manhandled you on there. Yeah.
And at that point, Fresno PD they already were starting to recognize me, and then they realized who I was. The fair EMS supervisor showed up. He knew who I was. And right away, my wife said they just parted the ocean.
Yeah.
And they got people out of the way. They got me to the ambulance.
Yeah.
Turned me over to an ambulance, and I was transported. And I had an alcohol bracelet on. And so the medic that was transporting me was like, well, you know, did you have anything to drink?
How much you have?
And I told her I was having a bunch, you know, I drank a lot. And my wife is sitting up front. She turns around. No, he didn't have anything to drink. He put I don't even know why he got the damn bracelet, you know? So we get to the hospital, and, you know, I think when they do the call in, I think I don't know. I think there was mention like, hey, like, we need to do something to protect privacy here. Because, you know, like, we're a large town, but we all know each other.
Sure, yeah.
You know? And I'm being transported to the level 1 trauma center.
Yeah.
You know, and that's a hospital we go to a lot. So everyone knows everyone, you know. And I'm in the back hallway, and I guess the MICN comes out to talk to me. One of the doctors comes out and talks to me, and they're just like...
And at this point, they've done an EKG, obviously.
No,
they've done blood sugar, all that stuff.
My blood sugar was checked, you know, because our protocol, the altered mental status protocol does, you know, we do check a blood sugar under that protocol. But like, there's only 4 reasons for us to check an EKG in the field. And the protocol is coronary ischemic chest discomfort, suspected cardiogenic shock, post-cardiac arrest with ROSC, and acute pulmonary edema.
And you're how old at this point? 2014? Or 2000, what is it, 13, 14?
I want to say 30. No, it was 2018. I think I was 35.
Okay.
I don't know.
Still,
34
yeah,
maybe.
Kind of right on that border of like...
Yeah.
Okay.
So, you know, but I guess they do the EKG at the hospital.
Okay. So you're there at the hospital. You're in the hallway.
tacking out.
Yeah.
So they have me in a back hallway, and I guess other employees see me, and they kind of see like, what's going on with Mario, you know?
Yeah.
So of course, cat's getting out of the bag really quick.
Sure.
The on-duty supervisor was there that night. And she right away is trying to make sure I'm protected. And they triage me, you know, they call in the little voceras, and they're like, hey, you know, this is who we have. Can we get him a room? I'm like, well, we have a room in Yellow Zone. Let's go to Yellow Zone. So I remember being in there, and my sister, who one of my proudest moments was when my sister became 18, I kind of said, hey, you should come on a ride along. And she came on a ride along, and she got bit. And now she's a critical care medic.
Oh, no shit.
So, you know, she's past me.
Yeah.
So beautiful. One of my proudest moments, but she's on duty that night as a paramedic, and she hears Mario's in the hospital.
Yeah.
So she goes, and I guess my wife meets her outside. She goes, what's going on? And she goes, just come in and just wait. You'll see. So my sister comes in, and she's just kind of like, I guess she's a little confused. And then all of a sudden she sees, oh, okay, you're fucked up. So I guess they're running all these tests, and at one point I got a little agitated, and I was trying to leave, but I couldn't walk. And so they kind of had to like position the bed to where I couldn't get up, and they used that time to change me out. And this is where I kind of start to remember things. I remember kind of coming to a little bit, but I was a little foggy, and Dr. Stroh is kind of at my feet, and he's talking to my wife. And I remember asking if I'm having a stroke. And he said, no, like your head CT's good, but we don't know what's going on. Your valproic acid's a little elevated, but you know, we're gonna do an LP on you and all this other stuff. And the LP, the only part I remember about the LP was getting a headache. I don't remember rolling over. I don't remember getting poked. I just remember getting a headache. And then they decided, well, we got to admit you, you know, like we don't know what the hell's going on here. Yeah. Your legs are, you know, not flaccid, but you don't really have a lot of strength there. So, and I remember getting an IV, and it's really weird because I remember looking at the nurse doing it, and he's talking to me. He says, hey, you take care of all of us. Now it's time to take care of you. Just relax. And I knew what he was doing, but when he did it, I just like, my wife said, I just became like really offended. Like, I was like, why would you do that? You know, like in my mind, I knew what I was doing, but when what he was doing, but when it was happening, there was a disconnect.
Yeah. Just odd.
Doesn't register the same way. Yeah.
So, now I'm starting to kind of come out of it a little bit more. And I remember going upstairs in the bed, and the nurses, they meet the floor nurses. They're like, hey, Mr. Paramedic. And I was like, what? And they're like, how's the fare? And I was like, well, what? And then I asked, how do you know I'm a paramedic? They're like, it's in your chart. Like, everyone's going to know. So, and the nurse came and talked to me, you know, the next day. You know, I was talking a little bit more, but I just was really weak, and like I had no strength. And the nurse says, you're not actually admitted. You're under observation, which means we're keeping you here until we figure out whether or not we need to actually admit you. So I was like, all right. So right away, they started doing all kinds of things. They started, you know, I was seeing all kinds of, they even had the psychiatry team come to see, is this psychosomatic? What's going on? Yeah. And the neurology team came in and says, we think you had a focal seizure. Or what was the word they used? They think I had a seizure, you know? They're like, your dad has seizures. Why not? Right. Right. So, and they said the thing like, do you ever see flashes or hear sounds or anything like that? I was like, I don't, like sometimes, like, I don't know. Yeah. Like, well, if you ever see a flash, let us know. And we will, we're going to do an EEG on you. And I was like, all right, fine, whatever. And it was like 2:00 that night. And they have the WOWs, the workstation on wheels in the room. Right. And it was flashing. Right. So I called the nurse. I was like, hey, the computer's flashing. Can we like move it? You know, she took that as, oh, you're seeing flashes. He's seeing flashes. Yeah. So right away, the EEG tech comes in. They put the thing on. It was a pain in the ass.
Like 3 a.m.
Yeah. And they were like, it looks relatively normal. The neurologist saw it. They're like, all right, we're going to do an MRI on you because we're thinking maybe ALS at this point, which I was like, Jesus, fuck. Yeah. I was like, no. I was like, yeah. So it was a 2.5 hour MRI. And have you
were in for 2.5 hours?
2.5 hours.
Jesus.
Have you guys ever had an MRI?
Oh, yeah.
So they put your head in that little cage.
Yeah. You're in a tiny tube.
They gave me 2 milligrams of Versed, and it was not working for me. And they had to pull me out. And I was like, can I like reposition? They're like, if we reposition, you have to do it again. The whole thing again. I was like, come on. So I said, just take the blankets off of me then. And then they put me back in for like the last 45 minutes. And somehow I just knocked out. Yeah. And MRI was done. They're like, everything looks intact. Tell me about your family. Any autoimmune disorders? I was like, well, my mom has, you know, arthritis. She has this other thing going on with her. I forgot the name of it, but it's kind of attacks her lungs and her kidneys. And like, all right, anyone with lupus? I was like, there's a family member on my dad's side who has lupus, but I don't know if that's also from a different relationship with his dad. So I don't know.
They're just pulling at straws at this point, trying to
like, what the hell's
get a direction,
on, right?
Yeah.
And at this point, they've done like, you know, obviously they did chest X-rays, and the only CT they've done is a head CT, right?
Sure.
How many days in are you at this point?
So at this point, I'm probably about 3 or 4 days in.
And how are you feeling at this point? You still feel like
I'm feeling okay. I'm just weak at this point. So they have physical therapy and occupational therapy working with me now, trying to get me to walk with the damn walker, and you know, and I'm starting to get a little bit of movement back. And
but you have no diagnosis.
No diagnosis.
4 days in.
Altered mental status. No, seizures, remember?
Yeah, that's right. That's what they're going
man.
Yeah.
Then they were talking about maybe, I want to say this is maybe around the 20th, 21st, 23rd. I don't know. they were talking about, all right, we're going to discharge you and look for like, you know, maybe some physical therapy programs for you. Well, no physical therapy programs wanted to take me because they're thinking like, there's no diagnosis that would explain what is happening to him.
Yeah.
So,
Right.
you know, maybe he could do some outpatient stuff. Great. How do I get there? So, and this is kind of random, but they asked me if I wanted a pneumonia vaccine. And I was like, yeah, sure. Like, whatever. I've been in bed all this time. Like, who knows what's going to happen, right? So they gave it to me sub-Q in the abdomen. And I thought that was kind of weird, right? And even the other nurses were like, why do they do it in your stomach? I was like, I don't know. Like, I've never had a pneumonia vaccine, so I just went with it, you know? And maybe around the 23rd, the day after they started talking about discharge, I was watching Age of Ultron in my room, which is a really good movie. And it sucks that I was watching the movie at this time because this is where things got bad. I remember thinking like, oh, like, you know, that spot where the shot got me is kind of sore. Yeah. You know, but I was like, oh, whatever. Right. And the pain just kind of steadily started to increase. And I was like, and the nurse came and asked if I was in pain. I was like, yeah, like maybe like 4 out of 10. And I made it a point. Like, there's no way you're going to tell me I have 10 out of 10 pain. I'm not going to say that. I'm not going to be that person. So
you're completely chilling in bed. Right. And, no, it's about a 10. Yeah.
Would you like some Tylenol? And I was like, sure. You know, give me some Tylenol. Right. And the pain it's getting worse. It's getting worse. And I'm like, man, she goes, how about some ibuprofen? I was like, let's do ibuprofen. Nothing. And it's getting to the point to where I'm like, okay, I'm pushing a 10 at this point. Yeah. So I have to like, I'm on my side and I'm like kind of curled up and I'm like teaching myself to meditate, you know? Yeah. So what I started doing is I just started counting and I just like closed my eyes and I was like 1, 2, 3, 4. And I got up to, I don't know how many hundreds. And then my mom walks in the room and she's like, hey, you're talking in your sleep. And just, it broke me like out of that, you know, because the pain was still there, but I was able to kind of, you know, manage it a little bit. And I was just like, oh, you know, and then they decided, all right, the doc came in. I was like, we got to do something about this pain. And she goes like, what is it at now? And I was like, it's at a 10. It's at a 10. Like, I'm like crying. I was like, please help me. And she's like, all right, we're going to take you to x-ray. Yeah.
And where's the pain exactly?
At this point, I would like to say right lower quadrant, but it was just, I couldn't figure it out.
At that point,
it was, you know.
Yeah. And the other thing is normally, because the only thing down there is your appendix, really. Right.
But I'm not even thinking about that. Yeah.
And that's what I was going to say. You had a shot there. Yeah. So your brain's going, God, that shot hurts, instead of like, what the hell's in that right lower quadrant?
Yeah.
And this is the first time in the 9 days that you've really had abdominal pain, right? Yeah. Or just pain, period.
So they decided to take me to x-ray. The x-ray tech comes and goes, all right, come and walk to this bed. I was like, dude, I can't walk, man. Yeah. I was like, not only am I weak, but I'm in a lot of pain. So you're like, you know, you got frustrated. And I was like, hey, I'm not trying to be that guy. I said, but I need your help. So he kind of helped me into the bed and they took me downstairs and they laid me flat and I started like to get nauseous. So I was like, you know, waving for a bag and they brought it to me and I was just dry heaving at that point. Yeah. And x-ray came back and they said I had a bowel obstruction. And I was like, oh, okay. They're like, you know, surgeon's going to come talk to you. And this is in the meantime, we're going to put an NG tube in there.
Which is serious on its own. Yeah, the bowel obstruction is no joke.
Yeah. So we're going to give you an NG tube. And I was thinking, and she goes, that's going to help, like, you know, any other air that's going down there, it's going to help it escape. And I'm thinking, okay, cool. Like, will this help with the pain? She goes, yeah. And I've never had an NG tube. And I want to tell you, it's torture.
Uncomfortable as hell, huh?
Torture. Yeah. So the nurse came in. She says, this is what you're going to do. She gave me a cup of water. We're going to push it down. And we're going to, you know, you're going to swallow water when you feel like you're going to gag and just keep going. Yeah. So finally,
and this is through your nose.
Yeah. After a couple minutes, she got the thing in there. And I was just like, you feel it in your throat. You want to keep swallowing because you feel like you're trying to.
For those that don't know, it's a tube that they stick through your nose, down through your oral pharynx, stomach, you know, in your esophagus, all the way down into your stomach.
Yeah. And it was not fun. So finally the surgeon comes in and he's like, hey, you have a bowel obstruction. When was your last bowel movement? When was the last time you passed gas? All this other stuff. And he goes, we don't think you need surgery. We think it's going to pass. But when the NG tube got passed, or when she was done with the NG tube, I was like, oh my God. I was like, the pain's kind of gone. Like it's still there a little bit, but I feel good now. Yeah. But I was miserable with this tube. So I asked the surgeon, I was like, do I need this thing still? And he goes, no. And I said, can we tell the nurse to take it out, please? And he goes, yeah, that's fine. Leaves. I tell my wife, hey, go get the nurse to take it out. And as soon as she walks out the door, I pull it out myself.
Yeah.
And then x-rays coming in to make sure it's in the right place. I was like, no, I don't need it no more. They said I don't need it. So I feel better. And that night I remember getting really cold. Like I was like shaking, and I asked for some warm blankets. I was like, sure, brought me some warm blankets. Then they came to check my vitals. Like, you have a fever. I was like, what is it? It's like it's 104 point something.
Whoa.
And I was like, great.
This is the day you were thinking you're going to get discharged though, right?
Yes.
Or like the next day, right?
Yeah, coincidentally.
Wow.
So I'm thinking, man, like, I have the flu. I'm going to die of the flu in the hospital, because I can't walk around, and it's going to turn into pneumonia, and so much for that vaccine. And then she's checking my vitals, and she calls her, you know what a Vocera is? It's like a little communication device that uses the hospital Wi-Fi, and they could talk to anyone in the hospital.
Sure, yeah.
She goes, hey, we need to call the doctor. And I was like, what is going on? Like, can you talk to me first?
Yeah.
And she goes, well, your heart rate's really high and your blood pressure is really low. And I was like, well, let's talk. What are highs and what are lows? She goes, your heart rate's about 150 to 160.
Which is no joke.
Damn.
And your blood pressure is 72 over.
Holy shit,
which is no
dude.
joke.
And I was like, huh. So they call the doctor, they do an EKG, sinus tac, and they decide to put me on a monitor for tele. And resting heart rate would be about 130. Anytime I would move, I would jump to 170, and the nurse would be in there really quick. Hey, you good?
Yeah.
I was like, yeah.
And you're just feeling cold at this point?
And they started labs. They started drawing cultures. And obviously the cultures take a while. Yeah. And the labs came back. My lactate was elevated.
Yeah.
My phosphorus was low. And I think my potassium was elevated. I don't remember. My labs were screwed up. And next morning, I'm good. Vitals are good. Doctor's like, hey, you gave us a scare. We're going to keep you. You're admitted now.
Yeah.
So
like, damn it.
That night, same thing again. So at this point, they're like, all right, you can't be here anymore. So they sent me to the step down ICU.
So bizarre.
You were med-surg?
Yeah, I was in med-surg.
Oh, okay.
Yeah. So went up to step down. Next day, the doc comes talk to me. He goes, and at this point, my vitals are staying crappy. And he's like asking me questions. And he goes, let's talk about your pain. And I said, well, he goes, where did you feel it? And he goes, I felt it like everywhere, and he was doing the rebound tenderness thing. I was like, no, I don't have rebound tenderness. I checked that after I felt better. Like it's not appendicitis,
Yeah.
And he goes, yeah, he goes, it'd be really weird if it was. He goes, but we found E. coli in your blood.
Oh, wow.
And I was like, oh, so I'm septic? And he goes, yeah. And he goes, we're going to do a CAT scan of your abdomen. I was like, all right. Did the contrast, drank the contrast. Disgusting.
Dude,
disgusting.
You had every like shitty procedure, diagnostic procedure.
Yeah.
Like the only thing you didn't get was like an angio.
Yeah, or they didn't check your rectum.
They send me down.
Right? It's crazy, dude.
They send me down to CT. Maybe an hour later, doc comes back up. He goes, hey, we've solved the mystery. And I was like, what's up? He goes, you have appendicitis.
Holy shit.
And I was like, me? Like,
yeah.
It's weird. We'll run on patients. Like, they'll say heart attacks will kill us before anything because we'll think that there's no way a heart attack's going to happen with me. I'm not going to have an MI.
Exactly.
Right.
And we'll ignore those signs. We don't humanize ourselves.
Yeah.
Right.
Yeah.
And so I was like, he goes, surgery's going to be here pretty shortly to talk to you. Like, we got to kind of get things moving here. I was like, it's just appendicitis. Like, what do you mean we got to get things moving here? I was like, let's go in there and take it out. So surgical team comes down and we got to resection your colon. We got to resection your small intestine.
Dude, Jesus. This is 2 weeks now after your initial arrival.
And I was like, wait a minute. Am I going to need a colostomy? And they're like, we don't think so.
Oh my God.
But I was like, I don't want that. Like, do everything you can to avoid that. And so that they wanted me to do the surgery. Well, I'm at the level 1 trauma center. Turns out that night, everyone was getting hit by cars. So my surgery kept getting bumped. Yeah. So I got my surgery.
You're minor compared to them. Yeah.
7:00 in the morning. I remember they gave me the Versed. And next thing I know, I'm being pushed down a hallway. And I remember the last thing I remember before going under was some asshole saying, hey, what's your coach status? And
dude, oh, Jesus.
I didn't think I said anything. And afterwards they told me like, they laughed because I said fuck off.
Right? I'm 35, dick.
So they're wheeling me to recovery, and I said, what about the surgery? They're like, oh, it's all done. Because it was just like I was out and I was awake. It was a 2.5 hour procedure. They didn't have to resection anything.
Oh, thank God.
And typically, like when I did my oral rotations, an appendectomy was 15 to 30 minutes tops. Yeah. So the surgeon came and says, hey, dude, it was a mess. There was gangrene everywhere.
Oh,
we were
God.
scraping
You
things.
perfed.
Yeah, and we found scar tissue. We think this has been happening over and over again for at least the past 6 months.
Holy
shit.
6 months?
Never had pain. But they said it looks like you've perforated, healed, healed again.
What the hell?
I was like,
I've never
Right?
ever heard of
And
that.
then-
He
dude.
had gangrene in his
Yeah.
nuts, dude.
And the
Oh,
best
my God.
part, he goes, and you actually, your appendix kind of split off. So that one's good. I was like, no. I was like, you took that one out too. Because I'm kidding. It didn't split off, dude. And they all kind of got to know me at this point. They knew I was a paramedic. And and then I developed peritonitis. And they had to stick the IR tube in, and I had a drainage tube. And I remember after getting that, I threw up because they had to do another contrast procedure to see kind of where if I did have peritonitis. And I remember before getting the IR tube, I threw up, and I was asking for a bag, and they didn't get it fast enough. And I looked down on the floor, and I see coffee grounds. And
you got GI bleed.
I'm like, fuck yeah. Well, coffee, I guess, should we explain coffee ground? It's not actual coffee.
Yeah.
It
looks like it a little
coagulated
bit.
blood, essentially.
it's
It's been
dark
sitting in your gut.
coagulated
Yeah.
blood because you're
When
bleeding.
we say coffee ground emesis, we don't mean you're throwing up your coffee. We mean you're bleeding.
Mhm.
So the nurse was like, well, shit, And I was like, yeah. All right. And
Sorry about the smell.
yeah. And it didn't have that smell. And it turns out what it was just the contrast.
Oh,
So,
it just looked bad. Yeah.
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 And all in all, man, I was there about 20 days.
Golly.
And I got discharged, and they wanted my white blood cell count to drop below a certain number before they would discharge me, because they ended up giving me a midline, and they were just throwing antibiotics at me. And finally, like on this day, I was like, I know my white blood cell count isn't where it needs to be, but please let me out of here. I hate this place. Like, you guys are great. You guys saved my life, but I don't want to be here right now.
You gotta go. Yeah.
And they said, all right, you drive a hard deal, and I was like, all right. So they discharged me. And the part that sucked was like for a couple weeks after, I couldn't taste anything.
Oh,
And
man.
it's because of the antibiotics.
Yeah.
Like pizza tasted like garbage. I wanted a soda. It just tasted like carbonated water.
Yeah. God.
But
Nightmare.
so October 14th is when everything went down. It turns out this had been going on a while before. And November 4th, I think, is when I got discharged. And looking back, like the only thing I could think of was like there were times when my blood sugar would just randomly drop. And I could just feel shaky and sweaty and just really weak. And I would eat and I would be fine. And I remember talking to my doctor about it. He goes, well, you're getting older, man. Like you gotta adjust your lifestyle, especially with what you do. You're going to be using a lot of sugar, a lot of calories. And so we kind of chalked it off to that because like my labs were fine.
Yeah.
But
Man, that is a crazy story.
So to recap all the shit that you had happen to you, you had an LP like the first night. This is an LP on its own is a hard thing. Like you're like bent all weird. They basically hammer into the bottom of your spine.
yeah, they got to fold you like a baby.
Yeah, exactly. And
Yeah.
that shit, that's a huge needle that they put in you, and they've got to extract, fluid out of your spinal canal, all this shit. That's a big thing. Then you had a 2.5 hour MRI.
Which, if you've never been in an MRI, it is claustrophobic as fuck.
Yeah, you're in a tiny tube basically, and
If
you
you're
can't
not
move.
claustrophobic, you will be claustrophobic
Yeah.
for that procedure.
You cannot put your hand up in front of your face.
You can't scratch an itch on your nose if you wanted to.
Yeah,
you
if you
couldn't.
breathe
can't
too
move.
deep, you
Yeah.
screw everything up.
Yeah.
Mhm. So you had that. You had multiple procedures where you had to ingest contrast.
Yeah.
But at least
CTs.
like 3 or so.
Yeah,
Go
I
ahead.
think so.
One
Right about that.
surgery or two surgeries?
One surgery. The
Oh, the NG tube.
NG tube. Oh,
NG
God.
tube.
The drainage tube for the abdomen, that really was kind of like I went to interventional radiology. They just numbed it up and stuck it in there. And that took care of like the hiccups that I was getting. And the other thing I forgot was, they couldn't close me up. It was about, I don't know, maybe a 6-inch wound.
Yeah.
Mhm.
And they had 2 sutures on either end, and they were packing it every day. pulling it out, packing it. Oh man, it's painful.
Yeah.
Damn.
So they started laparoscopic, which if they knew it was gonna be bad, I don't know. Maybe they had to. They started laparoscopic and really quick, they're like, nope, we got to go elbow deep.
Yeah.
And
Man.
Damn.
Any lasting issues from this, or did those antibiotics and the
no, like
scraping,
everything,
clean everything out?
I felt
do
like
it?
everything's good. I'm starting to do some research now to see if something like that like would increase my risk for colon cancer.
Yeah.
Because I don't know.
Who knows? Yeah.
And but I don't really feel like there's anything lasting. I think all in all, within about maybe a month after that, I was back at work. I was still trying to build up my strength, but I was like, I need to work. My first disability check did not come until a week after I got my first payroll check returning to work.
Dude.
So that's 2.5 months of
no pay.
Yeah,
what are we gonna do?
Yeah, it's crazy.
And luckily, like we had really good friends, and there was a GoFundMe set up. And, things worked out. But
crazy.
Yeah, man, it's a good lesson for those of you listening to this episode to listen to your body. Listen to your body.
But in your case, dude, they're saying you were walking around having appendicitis, having it perf, heal, and then have appendicitis again for months.
And you know what? And going back, I talk about the blood sugar. I also do remember having like an upset stomach, getting nauseous at times, like throwing up at times for unknown reasons.
You just don't remember having like a classic presentation of that pain
like,
and everything.
Oh, I was like, I ate something bad, I just don't remember thinking like, oh, that's got to be my appendix, I didn't have.
Yeah. Well, you don't think it could happen to you too.
Right.
Yeah. Yeah, man, I just like always kind of pay attention to shit that's abnormal for me. At 43 years old, it's like I know when I, eat dairy or something like that, my stomach's going to hurt. I know that. But if it happens out of the blue, out of nowhere, I'm like, oh, what the hell is that? And paying attention to it,
right.
Especially as you're getting older in middle age and, into our 40s and 50s, your body ain't working the same way that it used to when you were in your teens and your 20s. You can't, shit in all things, going out, you're not going to be able to drink the way you used to. You're not going to be able to exercise the way you used to, lift weights the way you used to. So pay attention to your body. If your body, if something keeps happening that seems out of the ordinary, go see somebody gets checked, but you got checked, right? For your sugar and stuff. So man,
A1C was great. They're like, it's not diabetes.
Yeah.
The only thing that was elevated is my cholesterol. And, that they're like, that's not even that bad,
I guess it's just another example of, you never know,
Yeah,
even if it's not something that happens, normally to people and stuff like that, you just, you never know what it could be.
You have a team of doctors at a level 1 trauma center. Sometimes you don't know.
Yeah. And it gets back to the story that I told in the beginning. If you guys are listening out there and you're in this profession, fire department, paramedic, or if you work in a hospital, you're a PA or something like that. Sometimes the obvious answer isn't the answer.
I remember Jerry Starkey. He was my primary paramedic instructor. And one thing he would always tell us when we were in paramedic school is the human body does not have to follow the rules.
Yep.
It can do its own thing.
Yep.
And it could throw you for a loop.
And it's adaptable.
Yeah.
You know what I mean? It's always trying to repair things that are wrong. And, just like in your case, it could think it's repairing something and the same thing happens again, stuff like that. That is such a crazy story, man.
Right.
I'm super glad that you recovered, that they figured it out, man, before there was any like serious.
Because the other thing too
effects.
is while they don't know what it is, it could be this, it could be this, it could be this. So you're just sitting there in a hospital like, okay, what am I dying of?
Yeah.
I felt like, I don't know, like, I felt like an episode of House, where they're like, a whole episode is like, what's going on with this guy?
Yeah.
And at the very end, they figure it out. And everyone's like, what?
Yeah.
No one saw that coming, you know?
Yeah, right? Like, where's
So
House?
they even threw the lupus thing in there. Like, you have lupus?
Yeah, to me, like you got tested for ALS, dude. This is like during the Ice Bucket Challenge years.
Right.
Yeah.
Man, that's scary.
Right? Yeah. Damn, dude. Well, thank you for coming in and sharing this story all the way from Fresno, man. We appreciate you, dude.
Appreciate it. Thanks for having me, guys.
Yeah,
right
definitely.
on, man. Is there anything you want to plug or have people follow you or?
Nah, I'm more of a lurker on social media.
You guys can follow me at DannyGonzo34 on Instagram.
Follow me at Ben9Humor, Ben number 9 Humor, like benign tumor on Instagram and Twitter. Follow our show at PRC Pod on Instagram and Twitter, or at PRC Podcast on TikTok. You can also email us, contact prcpod@gmail.com. You can buy our shirt. Danny's wearing one. Mario's going to get one for being a guest, but you at home can get one for a low price to show your support.
Yeah, help support the
stickers.
podcast, guys. We had a little rush of t-shirts, so we got a new inventory in, so we got plenty there for you. Order up a t-shirt, help the podcast.
Yeah, you get this hot logo on your back.
I'm growing the mustache back out so it'll match the t-shirt. So you guys
right on. Thank you, Petty Cash Studios, and everyone take care.
All right, thanks.